Hello, you're all welcome once again to Health Talk with Miss Irene. Our discussion today is on burn injuries. There are different types of burns. We have the thermal burn, the chemical burn, electric radiation burn, as well as smoke and inhalation burns. All these burns can be classified into degrees. We have the first degree burn, which is the superficial burn. It affects just the top layer of the skin, which is the epidermis. And we have the second degree burn, or the partial thickness burn. These affect the top layer and the second layer, which is the epidermis and the dermis. And we have the third degree burn. This is the full thickness burn. It affects all three layers of the skin. It affects the epidermis, the dermis, and the subcutaneous tissues. We treat burns according to the degrees as well as the percentage of the total surface area that the burn covers. Our focus today is on thermal burns. These are the most common types of burn that we have, and it is the most common with domestic burns as well. This is when we have hot liquids spill on the skin, or hot objects that we get our skin attached to, or they fall on the skin, hot solid objects that fall on the skin, as well as flames from fire and smoke and inhalation burns, sunburns. These are all considered thermal burns. Treatment for these burn injuries begins with stopping the burning process. So as quickly and safely as you can, you want to remove the heated or burning objects away from the skin contact. If it's flame, as safely and quickly as you can, get the person away from the flame to reduce the extent of skin damage. If it is hot liquid or hot oil that's spilled on them and they have clothes on, safely take the clothes off, and then you want to start the cooling process. Run cool tap water on small areas of burn for about 10 to 15 minutes to cool down the area. Remember, it's just cool tap water. If you have sterile water, that is fine. But remember, do not run cold water or ice water on these areas. This will damage the skin. And also be cautious if it's a large body surface area. Do not cool it down extensively. Just a little bit of tap water to get debris off if they are. That is fine. And then you wrap them on with some warm cloth or a clean cloth and send them to the hospital. Remember that the first layer of the skin is off. So if it's a large surface area, you run the risk of hypothermia. You get them very cold, and this can be very fatal. So you do not want to do that. You can treat first degree burn or superficial burns safely at home. These are burns usually caused by sunburns. They are just red. They present with redness on the skin. Sometimes they are painful, so you want to take over-the-counter pain medications for it. But the area is intact. It is not open. It is just red. You can just clean it with saline or water, run water on safely. And then you want to put maybe aloe vera ointment or cream topical on there just to soothe in the area, or Vaseline clean just to soothe in the area. That is fine. It should heal in about 5 to 7 days. So that you can safely treat at home. Second degree burn or partial thickness burn usually presents with blisters. If you have these blisters, please keep them intact. Do not pop them out. The covering or the roofing of the blister serves as a protective barrier to prevent infection from getting into your skin. The liquid in there is plasma. It helps protect the area and helps heal the wound as well. If you have extensive blisters or blisters that are covering your fingers and they are dense and very tight for you to move around, I'd advise you to go to the hospital. Usually at the discretion of the clinician, they will sterilize the area and pop it open in a very small area, drain it out just to keep the skin intact on top to prevent a very big open area. Partial thickness burns can be treated with antibiotic ointment. We can put that on, put a clean gauze on there, and you want to change it twice a day or daily. If there isn't a lot of drainage on, you can do that daily. If you have a lot of drainage, you want to change that twice a day and make sure that you have a good absorbent dressing on the area. You also want to put non-adherent, either antimicrobial dressing on or chlorhexidine dressing. It should be non-adherent so it does not stick to the area. You can also use a specialized burn occlusive dressing. Put it on for 7 days, and then you want to check to see if there is any healing. If you notice that it's not healing, it is draining, you have foul smell, I would advise you to seek medical attention right away. Third-degree burn or full thickness burn usually presents as a whitish area or grayish. It's ashy, or it feels leathery. The skin there is very hard, and they usually do not have pain. So if you have any burn and you notice that you don't have any pain, the area feels like I described, you want to take it to the hospital right away. No matter how small it is, you want to go get it checked. Usually third-degree burns will require some skin graft, so you want to go get it examined and check. If it's a big surface area, please seek medical attention right away. You do not want to stay home. Just because you do not feel pain doesn't mean that you've not had an extensive burn. You would have had extensive burn, but you might not know. Or burn areas that are circumferential should also be checked at the hospital. Usually if you have a burn that goes around your limb, either your arm, it goes around your whole arm or your whole leg, you want to go check it right away. You might be at risk of compartment syndrome, which can be fatal. So if you have a degree of burn, usually if it's an extensive second-degree burn or it's a third-degree burn and it's circumferential, as I said, please go get it checked. Burns that should be seen at the emergency right away are airway burns. Sometimes someone might be in a fire. They are physically not burnt, but they have inhaled smoke or they have inhaled heat. You would think that you do not see any physical burn on them and you keep them at home. I advise you that if you see that someone has been in an area of fire of any sort, you want to go get them checked. Usually, if you see that their lips are swollen, they are red, their nasal hair are all bent, their eyelashes looks like it's grayish or it's bent, it could be that they have inhaled heat that has presented with these symptoms. So you want to go get them checked, and especially if they're wheezing or they spit and you see it's dark, you want to go get them checked. As well as burns to the face, you want to go get it checked right away. The emergency burns to children, toddlers, no matter the degree of the burn, you want to go get them checked, as well as the elderly. And as burns on the extremities, especially your fingers, your toes, you want to go get it checked because these can cause mobility issues. You might heal these areas and you might not be able to move your fingers or move your toes. So any burn, if it's oil that's spilled on your fingers, your toes, please get to the emergency right away and have it checked. Do not treat these at home. As I always say, prevention is key. As much as we can, let's prevent these burns. Ensure that your fire alarm are in good working conditions. Let's make sure that our toddlers are not in the kitchen when we are cooking. Let's use the back burners of our stove as much as we can. Pots with long handles, remember we turn them away from the edge of the stove. Do not put hot liquids at the edge of the counter or at the edge of the table. When we fry with hot oils, let's put the oils away. Remember, oil-based liquid causes extensive burns. And usually when kids grab these, because they are very young, they're short, it spills all over their face and it causes a lot of scarring and it scars them for life. So let's protect them and let's protect ourselves. I hope you learned something from this. You stay blessed and you take care. Bye for now.